Well, state addiction experts say the use of prescription drugs and heroin are on the rise among youth in New Jersey's most affluent suburbs. It's high-risk behavior that often leads to devastating consequences. Tonight, in part 2 of her series, Addicted in New Jersey, Teens in Crisis, senior correspondent Denoia Aronsohn traces the challenging but crucial process of discovery and recovery.
This just doesn't happen here. There's no drugs in Rockaway.
Gary Baker is on a personal crusade. His motivation, a crushing loss.
This is Derek Paul Baker.
His son Derek started using the summer before his freshman year in high school. He was huffing, a practice where abusers inhale chemical vapors to get high. Gary says he and his wife had no idea until it was too late.
By having that denial, I might have gave him that time he needed to keep exercising his ability to keep abusing drugs, because it went to cocaine. It went to prescription pills. You name it, he did it.
When they did find out and got Derek into treatment, it was just the beginning of a grueling process.
I can't tell you the endless trips to psychologists, to the psychiatrist. I can't tell you the endless trips to these rehab centers with him.
Discovery, treatment, recovery. Expensive, tough, and for the addicted, the beginning of a lifelong struggle. Daytop Residential Treatment Center, which receives state funding, costs about $70 per day. Private rehab clinics are much pricier, as much as $2,000 per day. But the stakes are also sky high. The latest available state health figures from 2008 through the first half of 2009 count 211 drug or alcohol-related deaths among New Jersey youth, age 10 through 24. Ryan is a recovering addict and resident of Daytop. His parents didn't even know about his habit until he had hit his own breaking point.
I signed myself into a detox and stuff, and then they thought something was up because I asked for my insurance card. And they're like, what are you talking about? I'm like, well, I'll talk to you about it later. And then I came clean with them, and I told them what's been going on.
And their reaction?
Yeah, I think it was the first time I ever seen my dad cry.
Megan is also a recovering addict. She made her decision after waking in a hospital after yet another overdosing incident.
It wasn't like this magical, like, oh, I want to get clean type thing. It was like, it took time. Like, I knew I had wanted to get clean a couple times before that, but that last time, like, I saw my mom, like, crying, and for once it actually hurt me. It had never hurt me before that.
And so began the real struggle.
It's hard work.
Mm-hmm. It's a lot of hard work, especially when you have like really bad urges. It gets harder and harder.
James Tambini is mental health director at Daytop. He says recovery is especially tough for adolescent addicts who often have emotional wounds to heal.
Almost all of them have at one time or another been bullied through their school career. We try to get them in a position where they can begin to start a healing process.
Each year, Daytop treats about 200 girls and boys. So Tambini says they're not in a position to comment on the overall prevalence of drug use in the state. What he says he does observe, though, is an increase in the severity of the addictions they're treating here.
And often the most crucial period when it's time to go home.
I think one of the danger moments we see is right after discharge from treatment.
Raquel Mazon-Jeffers is the director of the State Division of Addiction Services. She says her agency is developing new ways to guide recovering adolescent addicts, including new medication to help quell urges for the drug and a new program called Recovery Schools.
This would really help create an environment of ongoing support for the young person where they could continue to sustain their recovery, refocus their peer group supports on people who share the same commitment and values as them.
There were no recovery schools when Derek Baker was fighting his addiction. And while he found his way out of addiction, graduated high school, and joined the Marines, after years of sobriety at age 22, Derek went into a backslide.
When they found him in his apartment, his girlfriend found him hanging. He hung himself. The syringe was still in his arm.
So Gary Baker is dedicated to bringing the prevention message to parents and kids. And studies suggest he's performing a profoundly valuable service. Statistics show delaying the start of alcohol or drug use until age 21 dramatically reduces the odds of ever developing a habit.
If you use underage, you have 1 in 5 chance that you will actually become dependent in the future.
I'm here to say to the parents, hey, wake up.
Marie Denoia, Aronsohn, NJN News.